Why do patients get hematomas after phlebotomy? Imagine a routine blood draw that unexpectedly leaves a bruise or swelling on your arm. This common occurrence, known as a hematoma, can be surprising and sometimes uncomfortable. Understanding why this happens involves exploring the intricate workings of blood vessels and the body's response to needle insertion. When a healthcare professional performs a phlebotomy, or blood draw, they insert a needle into a vein, usually in the arm. The goal is to access the vein's interior to collect blood efficiently. However, veins are delicate structures with thin walls that can be easily disrupted. If the needle punctures through the vein wall or causes minor damage to the surrounding blood vessels, blood can leak out into the tissues instead of flowing into the collection tube. Several factors influence the likelihood of hematoma formation. One key aspect is the integrity of the blood vessel walls. Fragile veins, often seen in older adults or individuals with certain medical conditions, such as bleeding disorders or vascular diseases, are more prone to injury. Additionally, the size and depth of the vein can play a role. Superficial or small veins may be more susceptible to puncture or damage. The technique used during blood collection also impacts hematoma risk. If the needle is inserted at an incorrect angle, if excessive force is applied, or if the tourniquet is left on too long, the likelihood of vessel injury increases. Proper site selection, gentle insertion, and prompt removal of the tourniquet help minimize trauma. Another contributing factor is the patient's overall health and medication use. Patients taking blood thinners or antiplatelet medications have a reduced ability to form clots, which means that even minor vessel injuries can lead to bleeding into the tissues. Similarly, conditions that impair clotting mechanisms, such as liver disease or certain genetic disorders, can increase hematoma risk. In some cases, the body's natural response to vessel injury involves blood leaking into surrounding tissues, creating a visible swelling or discoloration. The size of the hematoma depends on the extent of vessel damage, the amount of bleeding, and the body's ability to stop bleeding through clot formation. In summary, hematomas after phlebotomy occur primarily because of vessel injury during needle insertion, especially when blood vessel walls are fragile or when the procedure is not performed with optimal technique. Factors such as medication use, health conditions, and the anatomy of the blood vessels also influence the likelihood and severity of hematoma formation. Proper technique and awareness of patient-specific risks can help reduce the occurrence of these common, yet manageable, post-procedure complications.